Northern Arizona University researchers are part of a scientific breakthrough in treating infection. It's called the lateral flow assay, and it's the first diagnostic tool for biofilms. This microscopic image of staph bacteria is an example of a biofilm. Another more common example is dental plaque.
When you have plaque on your teeth, it usually is a community of microorganisms. In the mouth, most often there can be 30 or 40 different microorganisms that make up literally this film of living microorganisms on your teeth. The reason why it's so bad is because antibiotics don't kill these microorganisms when they live as a community.
A healthy immune system can't stop biofilms either, and they're responsible for many chronic infections and infection around implanted medical devices. 70% of community and hospital-acquired infections come from biofilms, and the Center for Disease Control and Prevention estimates the cost of fighting these infections at about $5 billion each year, a reason many people are eager to implement this device created at NAU.
If you can diagnose a patient quicker, more efficiently, the treatment options are much more broad, and you can get to treating that patient in a very specific manner, but in a much quicker manner, such that you don't start developing antibiotic resistance and things like that inside the patient. So the quicker you can diagnose these infections, the quicker you can treat, and the better outcome. And it turns out, actually, then the less money you spend on healthcare. So it's a big bonus.
Lab manager Allie Smith says the device is important for public health.
I think it would be pretty amazing for the patient to be able to be treated specifically for the disease rather than given broad range antibiotics and be treated for something, but nothing specific.
The diagnostic tool to detect biofilms was fashioned after the rapid strep test, where a small strip displays a line if the bacteria is present.
And so we thought, well, that's a pretty neat model because you could take that anywhere. So we started, that project I started 5 or 6 years ago, just discovering what biofilm-specific proteins were expressed by Staphylococcus aureus when it was living in the biofilm mode of growth versus when it was living as a single cell.
NAU graduate students helped lead develop this technology, along with Associate Professor of Biochemistry Tim Vail and researchers at the University of Maryland. A patent is pending for the new lateral flow assay device. It will then be ready for a company to license it and sell it as a clinical product.
One of the things I think that's really great for us is, we're not physicians, so we're not on the front line, but we do research and biomedical research to help other people. And I think this is one of those tools that is going to make the clinician's job a lot easier to treat people. So it'll have a positive impact.
Research is underway for other medical breakthroughs, and lab manager Allie Smith says scientific collaborations facilitate progress.
Yeah, we have a great team here at NAU. We have a great team that we collaborate with at TGen North, located here in Flagstaff, and Applied Biosystems and Banner Health down in Phoenix. They're amazing in being able to work with us and getting assays designed and getting us the isolates that we need to be able to perform this part of the research.
The future for this lab includes more biofilm research and a vaccination for staph biofilm infections.
So they'll run for 50 and then